Chapter 8, Day 2. Disorders of the sudoriferous glands is where we start. Sudoriferous glands are the sweat glands. Okay? Anhidrosis is a deficiency in perspiration or the inability to sweat, often a result of damage to the autonomic nerves. This condition can be life-threatening and does require medical attention. Bromhidrosis or osmodrosis, same thing, is foul-smelling perspiration. These people stink. Usually noticeable in the armpits or on the feet, and it's generally caused by a bacteria. Severe cases require medical referral. Bro, you stink. Bromhidrosis. Hyperhidrosis is excessive sweating caused by heat or general body weakness. It also requires a medical referral. Malaria rubra, also known as prickly heat, is an acute inflammatory disorder characterized by an eruption of small red vesicles and accompanied by burning and itching caused by exposure to excessive heat. This is where you get the kids that have the little red rash, and it's just because they're so hot. Okay, inflammations and common skin infections. Conjunctivitis is pink eye. It is very common, it's extremely contagious, and should definitely be referred to a physician. Any products that have touched that eye or implements, you need to get rid of products or very clean and disinfect any implements that have touched the infected eye. If you can, toss those implements too. Dermatitis is a term broadly used to describe any inflammatory condition of the skin. Eczema is an inflammatory, uncomfortable, and often chronic disease of the skin. It's characterized by moderate to severe inflammation, scaling, and sometimes severe itching. Herpes simplex 1 is a recurring viral infection that often presents as a fever blister or cold sore, although many people have no symptoms. It's characterized by the eruption of a single vesicle or group of vesicles on a red swollen base. The blisters will usually appear on the lips, nostrils, or other part of the face, and the sores can last up to 3 weeks. Herpes simplex 2 is caused by the same virus and is designated as type 2 because it occurs below the waist. Herpes simplex is contagious and requires medical referral. There are drugs available to control the symptoms, but the virus always remains in the body of infected persons. Impetigo is a contagious bacterial skin infection characterized by weeping lesions and usually caused by a Staphylococcus bacteria. Impetigo normally occurs on the face, especially around the nose, and is most frequently seen in children, although it is possible at any age. Psoriasis. Psoriasis is a skin disease characterized by red patches covered with silver white scales, and usually is found on the scalp, elbows, knees, chest, and lower back. It is very rarely found on the face. It is caused by skin cells turning over faster than normal, and when the condition gets irritated, bleeding points can occur. It is not contagious, but it does require a medical referral. It is treatable, but it is not curable. Skin pigment disorders. Hyperpigmentation. Okay, pigment disorder, first let me give you a little bit of a definition. Pigment can be affected by internal factors such as heredity or hormonal fluctuations, or by external factors such as prolonged exposure to the sun. Abnormal colorations, known as dyschromias, possibly a test question, accompany skin disorders and are symptoms of many systemic disorders. Okay, abnormal colorations, known as dyschromias, accompany skin disorders and are symptoms of many systemic disorders. Okay, so here are your pigment disorders. Hyperpigmentation means darker than normal pigmentation in splotches. Hypopigmentation is the absence of pigment resulting in light or white splotches. Albinism is congenital hypopigmentation or absence of melanin pigment of the body, skin, hair, and eyes. Chloasma. Chloasma is a condition characterized by hyperpigmentation on the skin in spots that are not elevated, generally caused by a cumulative sun exposure, and can be helped by exfoliation or can be treated by a dermatologist. I have a client that has chloasma, and it looks like her face is dirty. It's just that the sun exposure. She grew up on a farm. She's been in the sun all her life. She's in her 70s now, and she does see a dermatologist to help with it, but it really does look like her face is dirty. Lentigines is a technical term for freckles. Also can be referred to as liver spots in older adults, although there is no relationship at all to the liver. It has nothing to do with it, just maybe some of the coloring. Leukoderma is a skin disorder characterized by light abnormal patches, which is hypopigmentation. It's caused by a burn, a scar, inflammation, or some kind of congenital disease that destroys the pigment-producing cells. A nevus, number 7, nevus, is also known as a birthmark. It can be small, it can be big. It's just a malformation of the skin due to abnormal pigmentation or dilated capillaries. A stain is an abnormal brown or red skin patch. They can be circular, they can be irregular. Usually as you're aging, you see these after certain diseases, and sometimes after moles and freckles and liver spots disappear, you'll get these stains, which are larger. A tan. You know what a tan is. It's the change in pigmentation of the skin caused by exposure to the sun or ultraviolet light. Vitiligo is a hereditary condition that causes hypopigmented spots and splotches on the skin that often appear milky white. Skin with vitiligo must be protected from overexposure to the sun.